All right, client one. So after going over all of your information, it does look like medical clearance is going to be recommended. This is just because you have been out of exercise or regular participation of exercise for up to 2 years. And you're also having shortness of breath when you're going upstairs. So that's a good indicator that we should go ahead and get medical clearance. I did also notice that you have two cardiovascular disease risk factors, one being your blood pressure. So it does look like your blood pressure is pretty high. We're around in the stage 2 area. So with blood pressure, you should be at a blood pressure of around 120 over 80. That's basically classified as normal. And right now, your systolic is pretty high, so you're at 155 over 80, putting you at a risk for cardiovascular disease. Another risk would be that you are physically inactive. So that's putting you at 2 risk. And then we don't have your body composition information, but based off of your weight, I'm suspecting that your body mass index is another probable risk factor. So that's something we want to go ahead and get taken care of, having that assessment done. And I'll talk about that more in a minute. Also, after estimating your VO2 max, it does look like for your age, the classification, you are in the poor range. So right now you're at a VO2 max of 27, and basically VO2 max is how much oxygen your lungs can hold or uptake. So for your age to be classified in like the fair and good side, you're looking at wanting to be at 41 to 47. So that can be improved through exercise. So that is something we want to start improving slowly. Also, when going over your information, it does look like your max heart rate is going to be 184. This means that when exercising, we for sure don't want to go over that 184 beats per minute range. So I know you wanted to do moderate intensity exercises. So a good range, or to know if we're in that moderate range, would be having a heart rate from 119 to 139. And then again, not going over that 184, sorry. Okay, and then another thing, like I said earlier, that we want to go ahead and measure your body mass. So this can be done by the bioelectric impedance assessment. The purpose for this one, again, is just to estimate that body composition using the impedance technology. So basically, this is going to help us understand your health status and also see if you have any more potential risk factors for disease. Another test we could do is the skin fold. That one's pretty easy, quick and easy. And then if available, we can find like a bod pod. I know those ones are a little bit harder to come by and they're more expensive to do, which is why the skin fold or the bioelectric impedance assessment is going to be good for us to do. I did notice that you said that you wanted to do 3 days a week of walking at 2 METs. I do think this is a good starting point for yourself, but eventually that is lower intensity, so we would want to bring it up to around 3 to 6 METs to get you in that moderate range. So eventually, maybe we'll walk a little faster, or you can use something like an arc trainer. I know you do have knee issues, and with an with the arc trainer, that's going to give you a better range of motion than like the hard impact of like a treadmill, just so it takes some weight off of your knees, but you can also, move your body really well and bring that heart rate up where it needs to be. Another thing I would recommend is after we do our walking for 3 days a week at 2 METs, we not only start using like an arc trainer or kind of just any cardio that's going to get your heart rate in that moderate range, but also doing strength training. So again, because of your knees, I wouldn't recommend right off the bat jumping into like squats with weight, anything too weight bearing on the knees. So what I would recommend is like body weight movements, anything with like a TRX, which is basically these ropes that help assist you. So when we come down, you can kind of use your arms or your upper body to help you come up from that squat or help you come up from that lunge. Just for now until we do again build up that strength in our knees, and then from there we can start moving into lightweight. But I do think that would benefit you. And one, the cardio of it all is going to help increase your VO2 max, which is something we want to work on. But again, the strength training portion of it is going to help lessen that knee pain. It's going to make it easier for you to go up the stairs again with the cardio and just like relieving that knee pain. But other than that, I think you're good to go.